Have you or a loved one been injured in a motor vehicle accident? If so, there are several things you need to be aware of. Research has shown that car accidents at speeds of only 7 miles per hour are enough to cause significant injuries to the joints and ligaments in your cervical spine. Most injuries sustained in MVAs don't even show up for days or weeks after the accident. Even patients that are taken to the ER immediately after a motor vehicle accident can have many missed injuries. Injuries to the cervical spine require specialized imaging to diagnose them correctly. If these specialized studies are not done, then serious damage to the ligaments and joints of the cervical spine can be missed and go untreated. These type of injuries can cause accelerated degenerative conditions and increase risk for injuries in the future that may require surgery. But if they are correctly identified and, more importantly, correctly treated, then that future doesn't have to be a reality. Digital radiographic motion analysis allows us to see the joints of the spine actually move, and by using specialized software, we can plot and track the movement of each vertebrae as it relates to the ones above and below. This is termed a motion segment. What we're looking for is called an alteration of motion segment integrity, or AOMSI, which helps to diagnose these injuries, and really it is the only way to diagnose these injuries correctly. But again, more importantly, it allows us to develop a treatment plan or plans that are incredibly specific to each patient's injuries. And then we have a baseline for that injury, and we can track our progress to ensure that that segment or vertebrae is stable before we discharge the patient. Only in very specialized facilities like ours is this possible. These injuries to the ligaments and joints in between the cervical vertebrae are also one of the top factors that dictates a patient's permanent impairment and future disability related to these types of injuries. If they are not diagnosed and documented properly, then that patient is not going to receive the proper future care and accurate disability and impairment rating. Our process of diagnosis also takes into account shearing forces and side impact collisions, which are another area that is hugely missed by the ER examinations and many other providers. When examining these dynamic injuries, you have to take into account the directionality of the impact, the patient's position in the car, and what direction they were looking. Were both hands on the wheel? Did they brace for the impact? Bracing for the impact dramatically increases the biomechanical force and the kinetic energy and force that is transferred through that bracing limb and can cause injuries in the ankle, knee, hip, or low back, for example, if a patient is pressing down on the brake pedal. And again, these injuries might not appear for weeks or even months after the accident. By then, it's too late. Knee pain that begins 2 or 3 weeks after the accident, if it wasn't properly diagnosed and documented, then the insurance company is never going to agree to cover that. So all of these issues have to be taken into account. Other commonly missed injuries are low back pain and pelvic trauma caused from the seatbelt. Rather, if it's a side impact collision or rear end collision, either can cause serious injury to the lumbopelvic system. Because whiplash and concussions are typically the most common and most severe, oftentimes ERs and other providers won't bother to look at low back and pelvic if there's not a complaint there. We make sure that nothing is missed when we examine our patients after a significant injury. And that doesn't apply to only motor vehicle accidents. That can be any traumatic event or injury, whether it's skiing, mountain biking. The same rules and forces apply, and the same injuries are still very commonly missed. As I have said before, and I'll say a million times again, the proper treatment starts with the proper diagnosis. Another thing that sets our clinic apart is that we always shoot pre- and post-radiographic studies. If I can't show a patient that their original injury or structural misalignment is fixed, then I haven't done my job right. We want our patients to not only feel amazing, but we also hold ourselves and our clinic staff to the highest standards. And we have to ensure that a patient's spine is actually better before we discharge.